Hello viewers, welcome to the Joyful Path channel. Thank you so much for coming by our channel. Thank you for your support. I really appreciate every one of you. Thank you. This is your girl saying thank you. So today we will be having a discussion that centers around endometriosis and infertility. Endometriosis is a very serious condition, and during one of our previous videos we actually talked about severe menstrual cramps and some of the underlying causes that could have actually caused this severe menstrual cramp, and that is why we'll be coming today to buttress more on endometriosis and infertility, the signs and symptoms, the causes, and also the treatments and everything you need to know about endometriosis. So guys, stay tuned. What exactly is endometriosis? Endometriosis is a serious medical disorder. A serious disorder that affects the female reproductive system. And most times endometriosis comes with painful menstrual period. It comes with painful menses. Actually, menses is not supposed to hurt. Although some people experience mild pain, for some people they do not even experience any pain at all. Menstruation is not supposed to hurt to the extent that you have to start taking analgesic or you have to start taking a very strong pain relieving medication. No, it's not supposed to hurt to that extent. For some people, the pain becomes so much, it becomes so unbearable that it even interferes with their normally day-to-day activities. It's not supposed to come to that extent. For some people, menses doesn't even bother them, they are not hurt, no pain, and for some people it's just a mild cramp. So when menstruation now begins to hurt to the point that some people it passes out, some people become hospitalized, for some people they can't just go through their normal day-to-day activities. At this point, it could actually be that there is a particular condition that is actually causing this painful menstrual cycle, of which one of them is endometriosis. And that is why this video today we will be discussing what exactly is this endometriosis. Like I said earlier, endometriosis is a very serious medical disorder, and what actually happens in endometriosis is that when similar tissue to uterine tissue, when they begin to grow in other places outside the uterus, that is when endometriosis comes in. There are actually certain tissues which are referred to as the endothelial tissues. These tissues, they line the uterus. They line the uterus. We call them the uterine lining. So when tissues similar to these uterine tissues, when they now grow outside of the uterus, in places where they are not meant to grow, that is when endometriosis comes in. And what happens is that these uterine endothelial tissues, which are the endometrial tissues, these tissues actually respond to hormones. Normally within the cycle of the female, these hormones, they make the uterine tissues to thicken up and prepare for pregnancy. But when there is no fertilization, when no fertilization occurs, that is when this uterine lining, they now shed out the tissues, because there is no fertilization, so there is no pregnancy that they want to implant. There is nothing that is going to implant in the uterus. So this uterine lining is now being shed up, and that is when it comes out via the vagina, and that is when you actually see that menstrual flow, and you say this is menstruation. That is what happens normally. So when these similar uterine tissues now grows outside the uterus, most times these tissues, they begin to grow around the fallopian tubes. Sometimes they grow at the surface of the uterus. They don't grow in where the middle layer. They can go around the surface of the uterus. Sometimes they can grow around the fallopian tubes. Sometimes they can just go around the pelvic region outside the uterus. So when this happens, these similar tissues growing outside the uterus, they also respond to hormones. So they also thickens up. You know, as the normal uterine tissues are thickening up, preparing for pregnancy, all these similar tissues growing outside where they are not meant to grow, they also thickens up. And normally during menstruation, when the uterine lining is trying to shed up its lining and then blood comes out, these tissues growing outside, they also do what? They also shed their lining. But unfortunately, these other tissues, they have no escape route. Unlike the uterus, you know, the lining of the uterus, these tissues, when they shed their lining, they actually come out. They have an escape route, which is the vagina. That is when the menstrual blood flows out. They have escape routes. But for these tissues growing outside elsewhere, they do not have any escape routes. No, they have been trapped in. They are trapped within the pelvic region. They don't have anywhere to pass out. And when they are trapped in, there's no escape route for them for the blood to flow out, because they are not in the uterus. They cannot come out via the vagina. They are just trapped within the pelvic region. And when they are trapped in, then they begin to irritate the structure in which they grow. They irritate that structure and they start inflammation. So inflammatory process begins to set in. That area becomes inflamed. You know, everything that surrounds inflammation, because they are trapped in, they irritate the structures. You know, it causes inflammation. And then before you know it, other things begin to happen in that area. And that is when the individual begins to feel pain. This severe pelvic pain. And most times this also occurs around the time of the normal menstruation. So that is why the pain becomes so unbearable, because of the inflammatory process, because of the irritation that is happening within the structures, within the pelvic region, every other areas where these tissues are growing, they irritate the structures. And once there's inflammation and irritation, the bad thing is that these structures where they grow, they begin to form a scar tissue. And once there is scarring, once there is formation of scar tissues, they begin to do what? They begin to form adhesions. They begin to, sometimes they can adhere with other organs. You know, they are trying to join organs together. They can adhere with the uterus, and then this scarring and adhesion, you know, they begin to malform the structures of the reproductive system. And sometimes they can cause tube blockage, and that is what actually why endometriosis is very bad. I mean, that is why it is very bad, because once there is scar tissue formation, once there is adhesion and the tubes are blocked, you know, it makes fertilization to be very difficult to achieve. And once fertilization cannot occur, it also makes pregnancy to be difficult to achieve as well. That is why this condition is very serious. And then, what are the signs and symptoms of this endometriosis? The major sign and symptom, the main symptom of endometriosis is severe pelvic pain. Once there is pressure, you know, there is inflammation, the individual begins to feel this severe pelvic pain. That is a major symptom. Then accompanied with this pain is that this pain also comes alongside with the menstrual period. So it makes menstruation very painful. It makes it very painful. It is severe, you know, it is very chronic. And also accompanied with this, sometimes some people, they actually have pain during bowel movements, pain during urination. You know, the pelvic area, they are just feeling a form of pain and pressure. For some people, it could also be accompanied with nausea and vomiting. For some people, it could be accompanied with, you know, they just feel bloated. They just feel like, oh, everything around the pelvic region is not just going as it usually does. All these are the signs and symptoms of endometriosis. Another sign and symptom of endometriosis is painful sexual intercourse. Pain during and after sexual intercourse is also another symptom of endometriosis. Another symptom could be fatigue and many other symptoms. You know, many other things actually accompany this endometriosis. But the major sign is pain. You know, severe pain, pelvic pressure, and the likes. So if you are having any unusual symptom, anything that we are not sure of, the best thing is actually to reach out to your primary health care provider. So that what are now the treatment options for endometriosis? There are medical treatments and there are surgical treatments depending on the severity, but the most important thing is to reach out to your physician, reach out to your primary health care provider, because they will have to make some investigations, carry out some tests. They have to do probably some pelvic scans. You might have to do some magnetic resonance imaging, some histological studies depending on the severity. So based on whatever finding is being done, they will now decide what type of treatment is best. So that is why it is good for you to be in control of your body, know when things are not going the way they should, so that you can actually seek prompt medical help and get prompt medical intervention. So that will be all for today, guys. It's just a short video. I hope you are well informed. I hope you have learned one or two things about endometriosis, and I hope you will share this video with everyone around you, your friends, your sisters, your colleagues, any female that you know around you. Please do well to share this video, like it, share it, give it a thumbs up, and I will see you guys in my next video. Thank you, guys. Thank you.